Obesity is linked to poor physical and mental health outcomes, including heart disease, stroke, certain types of cancer, and depressive disorders. Reducing the incidence of obesity among African American and Black female adolescents will improve their quality of life overall. The mission of the Prince George's County Health Department is to protect the public's health, assure access to quality healthcare services, and promote individual and community responsibility for the prevention of disease. Dine, Learn, and Move is just one program that aims to reduce the incidence and prevalence of cardiovascular disease and related conditions of being overweight and obesity affecting Prince George's County residents. Weight reduction and healthy living services through the school-based wellness centers are offered in school health centers in 4 of the county's public high schools. The Prince George's County Health Department has earned the trust of students, parents, and administrators by currently working in Prince George's County Public Schools, and overall the department has years of experience conducting programs to prevent and reduce the risk of chronic diseases. The mission of the Prince George's County Food Equity Council is to improve public health and community well-being of all residents in Prince George's County by developing and supporting health policies and initiatives that create systemic change to the local food system. They promote the health and well-being of communities that have negatively been impacted by the current food system. The Council has hosted 3 food equity forums to discuss policy issues that affect residents, and the Council has also actively raised awareness for Prince George's County Public Schools' Universal Breakfast Program and other legislation for children's meal programs.
Unhealthy dietary habits may affect obesity rates in African American women. Cultural eating behaviors such as encouragement to finish all the food on one's plate and declining food as a sign of disrespect, as well as the lack of necessary skills required to cook healthy meals, may also have an impact. Out of all the fast food retailers in Prince George's County, 33% of them are carry-out restaurants and fast food chains, but only 12% are supermarkets and grocery stores. Without adequate transportation, residents must walk to the nearest convenience store, many of which do not offer fresh food options.
African American women may be unaware that the foods they eat are harmful to their health and well-being. 2/3 of public school students participate in the National School Lunch Program in Prince George's County, but PGCPS Food and Nutrition Services only provide a limited amount of nutritional information for the school food being served. The social consequences of being overweight or obese, such as feeling unsupported in making healthy decisions, and racial discrimination are also significant factors. Our nation's history of institutionalized racism has led to several health inequities that disproportionately affect the African American community. In Prince George's County, 75.5% of Black women are obese, while 61.8% of white women are obese. Chronic stress associated with perceived racial discrimination is directly linked to weight gain and obesity.
The first evidence-based intervention that we're including is called Alive. It's for adults 18+ and is personalized web pages and small step goals to increase nutrition knowledge and participant confidence. The second EBI is called the Kaiser Permanente Cafeteria Menu Labeling Intervention. It was originally in hospital cafeterias and increased nutritional knowledge. The third is called Body and Soul and includes cooking demonstrations in a church-based setting to increase participants' develop skills required to make healthy meals and increase positive attitudes and confidence in oneself. The last EBI is the Grocery Bus out of Austin, Texas, which resulted in increased access to grocery stores and healthy food options. Our intervention will primarily be implemented in Prince George's County Public High Schools. Adolescents spend most of their day in schools, so this is a great location to recruit through word of mouth, reach a large sector of the population quickly, and increase knowledge and positive behavior surrounding healthy eating. We will also work in community centers close to the schools. Overall, our intervention is a combination of evidence-based interventions to increase participant knowledge, positive attitudes, and skills regarding nutrition to increase administrative support, safe transportation, and resources to promote inexpensive healthy food options in their high schools. Our first intervention activity is adapted from Alive. This will include personalized emails and web pages with things such as goals, tips, advice, and more. To add to this intervention, we will add resources to their personalized web page, including information regarding racial discrimination surrounding longitudinal weight gain. This will occur weekly October through April and will address Goal 1, Objective 2, Goal 4, and Objective 5. Our second and third activities are adapted from the Kaiser Permanente intervention and will include menu labeling and poster distribution. For 12 weeks from September to November, small menu boards will be displayed at countertop level beside each food station with all the items' nutritional information. This same information will be hung on posters at the center of the cafeteria, and we will adapt this by now placing it in a school cafeteria rather than hospital. This will address Goals 1 and Objective 2 and 3. Our fourth activity is a series of nutrition seminars developed from MyPlate information that will occur for 8 weeks from October to November for 1 hour twice a week during health classes and will be taught by health teachers. These seminars will address Goal 1 and Objectives 2 and 3. Our fifth activity is adapted from the Body and Soul intervention. Cooking demonstrations will occur for 12 weeks from January to March and will be led by Food Equity Council volunteers at local community centers to address Goal 6 and Objective 7. Our last activity is adapted from the Grocery Bus intervention in Austin, Texas. We will now coordinate with the Food Equity Council to add at least 5 bus stops to local bus routes in Prince George's County to take residents to local grocery stores. This will occur for 16 weeks from January to May and address Goal 8 and Objective 9.
Our medium-term goals and objectives include Goal number 12, which corresponds to Objective number 13, as well as Goal number 14, which corresponds to Objective 15. Our long-term goals and objectives include Goal number 16, which corresponds to Objective 17, as well as Goal number 18, which corresponds to Objective number 19. The full Gantt chart is listed here and includes some of the activities that were not previously mentioned, such as quarterly staff meetings with health educators, school administrators, the Food Equity Council Director, and the Transportation Director. Our interventions personnel will include a program manager, 3 health educators, 1 UMD dietetic intern, a transportation coordinator, 3 Food Equity Council volunteers, and 1 BCH intern. Our necessary supplies include printed posters, flyers, and menus, menu stands, and the ingredients listed for our cooking demonstration activity. The total budget we are requesting is just shy of $49,000 after accounting for direct and indirect costs as well as in-kind donations.
In our intervention, we also ensured that we followed the Class Standard 13 to incorporate appropriate cultural and linguistic components within our projects. We did this by creating information and advertisements that were widely accessible and partnering with Prince George's County Food Equity Council that has experience with fostering strong community partnerships and knows what this population needs. In addition, we also utilized the universal designs for learning for our cooking classes and online resources. We used a variety of learning styles to allow for increased health literacy. For our process evaluation, we focused on measuring the extent to which the resources and activities embedded within the program were implemented as planned. For example, one of our research questions was to what extent were the posters promoting local inexpensive food options distributed throughout the schools. For our impact evaluation, we focused on measuring the change in short and medium-term goals based on the corresponding objectives that we had. For example, one of our research questions was, to what extent has participant ability to recreate the sections of MyPlate and list recommended servings of each food group per day changed? For our outcome evaluation, we focused on measuring the change in health and quality of life factors based on the corresponding long-term objectives that we had. For example, one of our research questions was, to what extent have obesity rates among Prince George's County adolescent, Black, and African American women decreased? For our communication and targeted messaging, we used communication strategies that were persuasive in nature. To do this, we used the widely known health belief model and targeted participants' susceptibility, severity, benefits and barriers, self-efficacy, as well as proper cues to action. We also utilized appropriate targeted messaging by using plain language and display features such as increased contrast for our menu displays and posters. We also made sure our cooking classes were interpersonal to encourage our population's participation.